He woke up on a Tuesday morning feeling fine, made coffee, sat in his usual chair by the kitchen window, read the news on his phone. His wife asked if he wanted eggs. He said yes. He was 67 years old, retired, no history of heart disease, blood pressure slightly elevated, but nothing his doctor had flagged as urgent. By the time the eggs were ready, he was on the kitchen floor. His wife called 911. The paramedics arrived in 8 minutes. He survived, but only just. And when the cardiologist sat across from his family in the hospital that afternoon, she said something that none of them were prepared to hear. She said his body had been sending warning signals for weeks. His wife remembered the indigestion he'd mentioned after dinner, the unusual tiredness he'd described as stress, the mild discomfort in his left shoulder he'd attributed to sleeping wrong. None of them knew what those signals meant. That is why I made this video today. My name is Dr. Victor Harlow, and what you are about to hear may be the most important 8 minutes of health information you will ever receive. Section 1. The 42nd America. In the United States of America, a heart attack occurs every 40 seconds. Not every hour, not every few minutes. Every 40 seconds. That is nearly 800,000 heart attacks every single year in one country alone. And according to the Centers for Disease Control and Prevention, heart disease remains the single leading cause of death among older Americans, responsible for 1 in every 5 deaths nationwide. But here is the statistic that most people never hear. Approximately 1 in 5 heart attacks in America is what cardiologists call a silent myocardial infarction, a heart attack that occurs with symptoms so subtle, so easily dismissed, that the person experiencing it does not realize what is happening until it is too late. And the population most vulnerable to silent heart attacks? Adults over 60. Because as the body ages, the sensitivity of pain receptors changes. The signals the heart sends during ischemia, reduced blood flow, become quieter, more ambiguous, easier to explain away as indigestion, fatigue, anxiety, or muscle soreness. The heart is still sending the signal, but the signal has changed its language. And today, I am going to teach you how to read it. Section 2. Why the heart sends silent signals. To understand why heart attack warning signs are so easy to miss, you need to understand what is actually happening inside a compromised heart in the days and weeks before a major event. Your heart muscle, the myocardium, is supplied with oxygen-rich blood through 3 main coronary arteries and their branches. When atherosclerosis, the buildup of fatty plaque on arterial walls, narrows these vessels, the heart muscle begins to receive less oxygen than it needs during periods of exertion or stress. This oxygen deficit is called myocardial ischemia, and it produces pain. But in many people, particularly older adults, that pain does not travel where you expect it to. The heart shares nerve pathways with the jaw, the neck, the left shoulder and arm, the upper back, and even the stomach. When the heart is in distress, pain signals travel along these shared pathways and are perceived by the brain as coming from those other locations instead. This is called referred pain, and it is the primary reason why so many Americans dismiss their heart attack warning signs as something far less serious. Beyond referred pain, in the weeks before a heart attack, the heart is often working under increasing strain. Blood clots form and partially dissolve around unstable plaque deposits. Blood flow becomes intermittent. The heart muscle sends repeated distress signals, each one potentially dismissed as something ordinary. Here are the 6 signals that the research shows most commonly precede a major cardiac event in adults over 60. Section 3. The 6 silent signs. Silent sign number 1. Unusual fatigue that appears out of nowhere. Not the tiredness that follows a busy day or a poor night of sleep. This is a profound, disproportionate exhaustion that appears without clear cause. Simple tasks, walking to the mailbox, climbing the stairs, preparing a meal, suddenly feel like enormous physical efforts. The fatigue is persistent. It does not resolve with rest. and it often appears days to weeks before any other cardiac symptom. A landmark study published in Circulation, the Journal of the American Heart Association, found that in women who experienced heart attacks, over 70% reported unusual fatigue as their most prominent symptom in the weeks prior, far more commonly than chest pain. This statistic matters enormously because unusual fatigue is one of the symptoms most consistently dismissed by both patients and physicians as stress, aging, or insufficient sleep. If your energy level has changed significantly and inexplicably in recent weeks, please do not explain it away. Sign number 2. Chest discomfort that is not quite pain. When most people imagine a heart attack, they imagine a crushing, dramatic pain in the center of the chest, like something from a movie. But the clinical reality for many adults over 60 is far more subtle. The chest sensation preceding a heart attack is often described not as pain, but as pressure, a heaviness, a squeezing, a tightness, a feeling of something sitting on the chest, or simply a vague discomfort that comes and goes over days. It may last only a few minutes before resolving. It may appear during physical activity and disappear with rest. It may feel mild enough to dismiss as indigestion or muscle tension. The American College of Cardiology identifies this kind of atypical chest discomfort as one of the primary reasons heart attacks go unrecognized in older adults until they become emergencies. Any new or recurring sensation of pressure, heaviness, or tightness in the chest, however mild, warrants medical evaluation, not reassurance. Evaluation. Silent sign number 3. Pain or discomfort in the jaw, neck, or left shoulder. This is the referred pain phenomenon I described earlier, and it is perhaps the most counterintuitive warning sign on this list. A dull ache in the jaw that comes and goes, a stiffness or discomfort in the left side of the neck, a pain in the left shoulder or upper arm that appears without injury. These sensations occur because the nerves supplying the heart and the nerves supplying these regions of the body converge on the same spinal cord segments. When the heart is in distress, the brain receives pain signals and attributes them to the jaw, neck, or shoulder rather than the heart. A 2018 study published in the American Journal of Emergency Medicine found that jaw pain, in the absence of any dental cause, was a significantly under-recognized prodromal symptom of acute myocardial infarction, particularly in adults over 65. If you have developed a new unexplained ache in your jaw, neck, or left shoulder, and you have any cardiovascular risk factors, please mention this to your physician immediately. Silent sign number 4. Shortness of breath during activities that never caused it before. Becoming slightly winded after intense exercise is normal. Becoming noticeably short of breath while doing things that never previously caused breathlessness is not. Walking from the bedroom to the kitchen, climbing a single flight of stairs, getting dressed in the morning. When the heart muscle is receiving insufficient oxygen, it cannot pump blood as efficiently as it should. The lungs must work harder to compensate, and the result is a shortness of breath that is disproportionate to the level of exertion being performed. This symptom is frequently attributed to being out of shape, gaining weight, or simply aging. But in the context of cardiovascular risk, it is one of the clearest signals that the heart's pumping efficiency is being compromised. Research from the National Heart, Lung, and Blood Institute identifies unexplained exertional shortness of breath in adults over 60 as a red flag symptom requiring urgent cardiac evaluation, not lifestyle coaching. Silent sign number 5. Persistent indigestion, nausea, or stomach discomfort. This is the sign that sent the man in our opening story to the kitchen floor. The stomach and the heart share the vagus nerve, the longest nerve in the body, running from the brainstem through the chest and into the abdomen. When the heart is under ischemic stress, the vagus nerve can trigger gastrointestinal symptoms, including nausea, indigestion, upper abdominal discomfort, and even vomiting. These symptoms are overwhelmingly attributed to dietary choices, to acid reflux, to stress, to something that was eaten. But when gastrointestinal discomfort appears without a clear dietary cause, particularly in someone with cardiovascular risk factors, and particularly when accompanied by any other sign on this list, the heart must be considered as a possible source. A study published in the New England Journal of Medicine found that nausea and upper abdominal discomfort were present in approximately 50% of women experiencing a heart attack, and were frequently the primary presenting complaint, leading to significant delays in diagnosis and treatment. Indigestion that appeared without dietary cause and does not respond normally to antacids deserves more than a second dose of medication. It deserves a phone call to your doctor. Sign number 6, a feeling of impending doom or unexplained anxiety. This final sign is the least discussed and among the most clinically significant. A sudden, pervasive sense that something is deeply wrong, not a specific pain or discomfort, but an overwhelming feeling of dread, of wrongness, of the body communicating an emergency that the conscious mind cannot yet identify. This phenomenon, described in medical literature as anger animi, literally meaning anguish of the soul, has been documented in cardiac patients for over a century. It occurs because the autonomic nervous system detects profound physiological distress and generates a global alarm response, experienced consciously as a feeling of impending doom. Research published in the journal Heart found that this symptom, when reported in combination with any physical cardiac symptom, was strongly associated with acute myocardial infarction and should be treated as a medical emergency. If you, or someone you love, ever experiences an unexplained, overwhelming sense that something is terribly wrong, combined with any of the other 5 signs I have described today, please do not wait. Call 911 immediately. Because in cardiac emergencies, time is muscle. Every minute of delayed treatment costs the heart irreplaceable tissue, and every minute of acting on these signals could save a life. Section 4. Why Americans are uniquely vulnerable. Now I want to address something specific about why Americans over 60 face a particularly elevated cardiac risk compared to their counterparts in many other developed nations. 4 factors converge in the American senior population in a way that is largely unique to this country. The first is dietary pattern. The standard American diet, high in processed foods, refined carbohydrates, sodium, and industrially processed seed oils, creates a chronic inflammatory environment that accelerates atherosclerotic plaque formation in the coronary arteries at a rate significantly higher than plant-forward dietary cultures. The second is sedentary lifestyle. According to the CDC, less than 30% of American adults over 65 meet the minimum recommended physical activity guidelines. Sedentary behavior is an independent risk factor for cardiovascular disease, separate from and additive to diet, blood pressure, and cholesterol. The third is uncontrolled hypertension, despite over 60% of American adults over 60 having hypertension. A significant proportion remain either undiagnosed, undertreated, or non-adherent to treatment. Chronically elevated blood pressure is the single most modifiable risk factor for both heart attack and stroke. The fourth is healthcare access and delayed diagnosis. In a healthcare system where the average primary care appointment lasts less than 18 minutes, subtle warning signs are frequently overlooked or normalized. Many Americans over 60 avoid medical consultation due to cost concerns, insurance complexity, or a cultural tendency to minimize symptoms until they become undeniable. These 4 factors together create a cardiovascular risk environment that makes the 6 warning signs I described today not just medically important, but urgently, personally relevant to virtually every American adult over 60 watching this video right now. Section 5. The 5-step heart protection protocol. Now let me give you something concrete, something you can begin today. Because the most important message I want to leave you with is not fear. It is this: heart disease is not inevitable. And heart attacks, in the majority of cases, are not random. They are the endpoint of a process that can be interrupted, slowed, and in many cases, prevented entirely. Here is the 5-step protocol that the cardiovascular research consistently supports for adults over 60. Step 1. Know your 4 numbers. blood pressure, LDL cholesterol, fasting blood sugar, and resting heart rate. These 4 numbers tell more about your cardiovascular risk than almost any other measurement available. If you do not know all 4 of your numbers right now, your first step is to schedule a blood panel this week. You cannot manage what you have not measured. Step 2. Eliminate the single most damaging dietary habit. Reducing ultra-processed food consumption, packaged snacks, fast food, processed meats, and refined grain products is the single highest impact dietary change an American senior can make for cardiovascular health. A 2023 meta-analysis published in the British Medical Journal found that each 10% increase in ultra-processed food consumption was associated with a 12% higher risk of cardiovascular disease. Start by removing 1 ultra-processed food from your daily routine this week and replace it with a whole food alternative. Step 3. 30 minutes of walking 5 days per week. This is not a suggestion. It is one of the most evidence-supported cardiovascular interventions in all of medicine. A meta-analysis published in the European Heart Journal found that regular moderate-intensity walking reduced cardiovascular mortality by up to 35% in adults over 60. No gym membership required, no equipment, no cost, just consistent daily movement. Step 4. Omega-3 fatty acids daily. 2 servings of fatty fish per week, or 2,000 to 3,000 milligrams of a high-quality fish oil supplement daily, has been shown in multiple large-scale trials to reduce triglycerides, lower inflammatory markers, reduce platelet aggregation, and measurably decrease the risk of fatal cardiac events. Step 5. Act immediately on warning signs. If you experience any combination of the 6 signs I described today, unusual fatigue, chest discomfort, jaw or shoulder pain, unexplained shortness of breath, digestive symptoms without dietary cause, or a feeling of impending doom, do not drive yourself to the emergency room. Do not wait to see if it passes. Call 911. In a heart attack, every minute without treatment costs the heart approximately 2 million muscle cells. Time is the single most important variable in cardiac outcome. Use it wisely. The man in our story at the beginning of this video survived his heart attack. He spent 4 days in the hospital. He had a stent placed in his left anterior descending artery. He completed cardiac rehabilitation. He changed his diet. He walks every morning. He is alive. But he will tell you himself, the signs were there, weeks before, clear as day, in hindsight. The fatigue he blamed on stress, the shoulder ache he blamed on his pillow, the indigestion he blamed on dinner. His body was speaking. He just did not know the language. You do now. Share this video with someone you love who is over 60, with your spouse, your parent, your neighbor, your closest friend, because this information costs nothing to share, and it may be worth everything to receive. If this channel has given you something real today, something that makes you feel more prepared, more informed, and more in control of the health of the people you love, please subscribe. Every single week I bring you science-backed health education built specifically for your body and your stage of life. Because the 40 seconds that pass while you watch the end of this video represent one more American heart attack. Let it not be yours. I am Dr. Victor Harlow. Stay strong, stay informed,